Hello and welcome to Newscentre. I'm Archana Solanki. Rajasthan has become India's first state to pass the Right to Health Bill. It's a legislation that mandates all hospitals, including the private ones, to offer free treatment in case of an emergency. But this bill has made the private doctors very angry. The visuals on your screens reflect the sentiment on the ground. The doctors are on strike, and the state of Rajasthan is witnessing a healthcare crisis. The doctors are asking who will pay for the free treatment and who defines what an emergency is. In their defense, the Ashok Gehlot government has assured that private hospitals will be reimbursed, yet the doctors are firm that the government roll back the bill. I will be joined by doctors and experts to take this discussion forward. But before that, let me get in Ayushman Kumar of moneycontrol.com, who's tracked this story very closely. Ayushman, thank you for joining us. This bill has polarized many people. While many are calling it a pro-patient or a pro-people decision, the others are calling it an election stunt. What are the doctors' main concerns?
Well, Archana, thank you for having me. The important concern here from the doctor's side are numerous, but we spoke to both the stakeholders, the government as well as the private doctors as well as hospital associations. Now, the doctors primarily have called for a withdrawal, a complete withdrawal of this bill, which is going to be a law in Rajasthan because it has been passed by the assembly. Now, there are core concerns of first is that the clarity is not there on what consists an emergency. Although the Supreme Court clearly defines that private institutions, also the hospitals cannot reject a patient if an emergency case is there, like a snake bite is there or an accident is there. What the doctors are saying that when the government says that emergency, any patient can come and can say without a definition of emergency that his stomachache or headache is an emergency, and they cannot deny that. Now, the second and important point that they are saying is that government has not made a financial outlay of what actually it is keeping for the private hospitals to pay when they are going to give the bills. Now, without any clarity on what the hospitals are going to get when they treat the patients for free, is something that is a bottleneck. And third, and the most important is what they say is the inspector Raj or the bureaucratic interference that they fear will happen once this becomes a law, because any or every patient from those who are not being given the treatment in the public hospitals will rush back to the private, and there will be an authority which will tell them that you have to treat the patients, but the private health infrastructure will not be able to do that because they don't have the clarity on emergency and the payment module. So these are primarily the concerns, and that is what the government, we also spoke to the government that is saying that somewhere IMA, Indian Medical Association, has been there in loop with the conversation, and they were the ones who were the key stakeholders. And now the government is also having back channel talk with the protesting doctors. What is the core concern is that the doctors want a complete withdrawal, what we saw, and the government seems to be not agreeing on that, Rachna.
All right, thank you, Ayushman, for that. Now, to take this discussion forward, I'm joined by Dr. D.R. Rai, the former Vice President and Secretary General of Indian Medical Association, Chhaya Pachauli, the State Coordinator of Jan Swasthya Abhiyan, Rajasthan, and Shekhar Yadav, Dr. Shekhar Yadav, the State Convener of United Private Clinics and Hospitals Association of Rajasthan. Thank you so much for joining us and making time on CNBC-TV18. I would like to start with Dr. Shekhar Yadav. Dr. Yadav, you are somebody who has been strongly opposing this bill. For the benefit of our viewers, could you tell us about the ground realities as to why the private doctors are against it?
Actually, thousands of doctors and other healthcare workers are on roads just because of a wrong policy, wrong act. And this act, every doctor feels that this act is so draconian that every private hospital will struggle for its survival. I would like to mention here that in the preamble itself, the government has mentioned that why they are bringing this bill to address the persisting inequitous accessibility and denials in the matter of health, healthcare in the state. So they have accepted that in last 75 years, state government has failed to provide AAAQ compliant healthcare services which are accessible, acceptable, affordable, available, equity, and quality comprehensive. So now government wants to shift this burden to private sector, and private sector is in no mood to take this burden. They haven't decided list of emergencies. They mentioned that accident victims, road traffic accident victims, victims of animal bite, snake bite, and obstetric cares. And they have added the list of other emergency diseases will be decided by the state health authority in the rules. Which hospital will cater to these patients? Public healthcare institutions, healthcare establishments, and designated healthcare establishments. They haven't decided which will be the designated healthcare establishments.
Right.
Then patient will walk in. He doesn't need to pay anything. After treatment, he can walk away and government will pay. They haven't disclosed what will be the mechanism of reimbursement, how will they reimburse, how much they will reimburse. So this is basically a very badly drafted bill, bad bill.
All right. To answer that, I'm joined by Chhaya Pachauli. Chhaya, you heard Dr. Yadav, put across his concerns that there is no clarity on what kind of reimbursements are we looking at, what is the process, and you're someone who's worked very closely with the Rajasthan government as far as healthcare is concerned. What is the government's defense, and what do you want to say, who's worked so closely with the government as far as healthcare reforms is concerned?
Well, I think some of the concerns of Dr. Yadav are valid enough, and I guess I understand where these concerns are coming from. These are essentially from their past experiences of working under the Chiranjeevi Yojana or the Ayushman Bharat Yojana, the health insurance schemes implemented by the government, which work on the similar model wherein the private hospitals, they provide cashless services to the patients and the amount is later on reimbursed to the hospitals. And I guess there have been, some shortcomings in that particular model, and there have been delays in reimbursement or and the hospitals have been a little concerned about it. But I guess, a lot of things regarding an act become more clear when the rules are framed. And in certain areas, it makes more sense to leave those things for the rules rather than to include them in the main body of the act, because some of these things are bound to change in the future. For example, Dr. Yadav said that the rates of packages have not been given in the act. So it makes no sense to give the rates of packages in the act because, the rates are bound to change in due course of time, with inflation and all. Once you have the rates in the act, it kind of gets frozen and in the act, and it becomes very difficult to make any changes into it later on. So I think the doctors, what I would urge to the doctors is to be a little patient and to have some faith in the government. I guess they are very open to negotiations. And also when the rules are framed, and as Dr. Yadav himself said that, a lot of things would be decided by the state health authority. So the state health authority essentially is composed of officials from the government, the health department, and there are going to be IMA doctors therein. So they shouldn't really be, have concerns as in, who are the people who are going to decide. It essentially are going to be the doctors who are going to decide, what the emergency cases are actually going to be, which would be covered under the act, and what would be the packages and how the reimbursements would be done. I guess it also is a great opportunity for the private sector to negotiate that the government comes up with a robust system of reimbursement. They can suggest what kind of system do they want, and they should, I guess, have very open and very frank dialogue with the government on this. And I guess, there are certain ambiguities. I won't deny that, but there's a lot of scope of, having more clarity on them when the rules are framed. We should not really be rejecting the entire act just because, there are a few clauses with which the private doctors are not really happy.
All right. Let's bring in Dr. D.R. Rai. Dr. Rai, IMA has threatened to intensify their protests in the days to come if the bill is not rolled back. Do you think it is time to have an open conversation with the government? In the amended bill, we have seen that the government has made space for IMA representation.
And Archana ji, rightly you have told, as far as the IMA is concerned, it is the parental body of all the doctors of the country. And when we saw the doctors, our community suffering in Jaipur, in the Rajasthan, it was our duty to. And we have approached to the Governor General also of the Rajasthan. We have requested them. First of all, let me clear one thing. As you have told rightly, that it is a right of health. Madam, it is not the right of health, it is the right of treatment only. If you take the definition of the health which has been given by the WHO, the health is a state of complete physical, mental. In these components and the social well-being, these components had not been at all written, at all mentioned in the draft. Anyway, now if we will discuss that, it's not. Now, as far as the treatment part is concerned, it is a right of treatment being given to the patients only. When there is a Chiranjeevi Yojana, when there is a RSG is running very nicely, what was the hurry when the doctors were approaching to you? And once, just now you told hurriedly, the day it was introduced in the parliament, in the assembly, it was passed. Same day on the Jaipur city, same day in the evening, Jaipur city was full of posters mentioning, we promised, we had done it. We have promised. Means this is the gimmick which is being played by the Honorable our Chief Minister or by the government itself, because they want to just give some incentive to the public for the votes only.
Right.
Now the question comes of the doctors. My friends from Jaipur, they have number of times approached and they have sat with them. They had a meeting with the officers also. They suggested and they agreed. But when the bill was introduced in the assembly, nothing was mentioned at all. Nothing was mentioned. Now the question comes again of the emergencies. It is not clear what are the emergency, what is not the emergency. A pregnancy is always managed, and family is also considering that on such and such day we will be visiting that hospital. Anyway, heart attack, that is the biggest emergency. They have not mentioned. Okay, they will mention afterwards. Now the question comes. Now, previously they told that they will be having 50 bedded and above hospitals. Now they are planning to put all the hospitals. A emergency, unless the hospital is not fully equipped, how they will take it? It's not possible.
Okay.
And if they will start treatment, they are not having the facilities and other equipments also. Some mishap happens. Every day there will be a fight with the doctors and with the staff and with the patients only. That government is not considering at all. When our association in Jaipur, they have requested the government, sir, you remove the private hospitals, government and the medical colleges, you put them, because they are having each and every facilities there. So you give to them, but they don't want to listen. They say, no, we will do it. We have decided, because they have promised in their last manifesto that they are going to give free health facilities. How it's possible? As far as the rates are concerned, the Madam Chhaya was telling that it will be for last more than you can say 20 years or 18 years. Not a single rate has been enhanced. Every day they are reducing. Can you think a doctor, specialist, super specialist agreed to treat the patient in Rajasthan at a consultation fees of 135 rupees? Do you think it is justified? Anyway, because we doctors had taken this profession as a choice, not as a compulsion. We are giving our services, but still the government wants to put a sword on our neck and they want to strike. The second thing, see what is happening. More than 1 lakh doctors and paramedical staffs were on the road. See the severity of this agitation. You know, whenever the leaders or whenever the political parties are arranging the dharnas or rallies, they used to hire the person, they pay the money, they pay that everything.
Okay.
Then only there is a position to collect from 20,000, 50,000. And here, doctors, paramedics, their staff and their families, they were on the road. My sisters, lady doctors, they were having their children in the lap and they were also moving. Government is not considering, because government is adamant on that. Government never thought. And I tell you, we have requested, we have given a letter to the Chief Minister also. Sir, you remove this, you roll out this one, roll back, and then sit with the doctors also. we are always ready to help. Otherwise also, we are helping in each and every scheme of the government taken throughout the country.
All right.
Whether and today I feel very bad. The government has forgotten the services given by the doctors at the time of COVID, when the children's son and daughters were not ready to touch their father if he was suffering from corona. Who was the person? These doctors. Even they never went to the cremation ground. And who were the person? These doctors only. And
Yes.
today, when the doctors are asking something right, you don't have anything. You are treating them as we are asking something extra. Today also,
Okay.
I'm ready to tell you, government is always interested to put a pressure on the doctor community. They are always doing this thing. Once we ask them, you appoint the doctors on a regular basis.
All right,
they
doctor.
will never
Yes.
give the permanent job. They will employ only on an ad hoc basis or on contractual basis.
All right, Dr. Rai, I have run out of time on the broadcast, but thank you so much for such strong words. In 10 seconds, Mr. Yadav, Dr. Yadav, if you could tell me, what if the government doesn't roll back this bill? What happens? And there is a very, very strong criticism that this bill aims to destroy the business model of the doctors, because not all, but many private hospitals are accused of extracting money from vulnerable patients. In 10 seconds, please.
Doctors of Rajasthan, almost every doctor of Rajasthan is not ready to accept anything less than rollback. Anything less than rollback. We have umpteen number of meetings in last 1 year with government officials. We tried our best to convince them that many clauses of this bill, they are not implementable even in government hospitals. I can tell you that even in some new medical colleges, they don't have the facility, they don't have the services of some neurosurgeon, cardiologist.
Okay.
So suppose a head injury patient goes to a medical college and there is no neurosurgeon, how will they ensure right to health in their own centers? Medical colleges are centers of excellence and you can't refer a patient from a medical college. So even your medical colleges are not equipped to handle a situation after right to health bill.
All right, point taken. Thank you so much, Dr. Shekhar Yadav, Dr. D.R. Rai and Chhaya Pachauli for your time. I hope there is a consensus and that all parties can come on the negotiating table and have a consensus so that this healthcare crisis that's brewing in the state of Rajasthan is resolved at the earliest. Thank you so much for making time. We're now heading into a short break, but coming up next, India's G2 Sherpa Amitabh Kant is chairing the second meeting and it's underway in Kerala at the moment. Stay tuned, we'll be back.